Now at Sutter Health, we operate 21 emergency departments across Northern California. I actually sat down and did the math. Once every 10 minutes, a patient or a person will walk into one of our Sutter EDs with a mental health concern. Think about that for a minute. Every 10 minutes around the clock, somebody is walking into one of our 21 EDs with a behavioral health crisis. And so for people who do come into our emergency departments in crisis, I've watched our ED teams actually struggle and try to find placement for these patients that need that higher level of care, sometimes on the phone for hours doing, playing phone tag with psychiatric facilities trying to get a transfer going at the expense of other patients that are sitting in the emergency department lobby waiting for a bed or to get back. Yeah, we had a lot of chaos going on before we started XFERALL. We had 21 different hospital EDs that were doing their own thing, 21 different ways, if you will, all with their own workflows, all with their own Rolodex of favorite psych facilities, often duplicating efforts. And that was really, really inefficient. And so we understood really early on that in order to fix this problem, we weren't going to be able to optimize it locally, but rather let's take a systematic approach. So we actually built what we call now affectionately known as our XFERALL Command Center, in which all of the referrals that come into Sutter Health, because we also operate 4 of our own psych hospitals, every referral that comes in, either from external or even from one of our own hospitals, goes through this central command center model. We do track a lot of metrics around XFERALL. Since launching our command center model at Sutter Health and integrating XFERALL into that, we've seen almost a 15% reduction in ED door-to-door times, and that's system-wide. That's a system-wide number with only 11 of our 21 emergency departments implemented so far.